Welcome everyone to We Heart Therapy. You're watching the special series, Your Guide to Therapy and Coaching, and I'm your host, Anabelle Bugatti. Today, we're talking about a very important subject, and that's traditional talk therapy, which most therapists would use the acronym CBT or cognitive behavioral therapy. And we have a special guest today, Jessica Marchena. Did I pronounce that right?
Marchena, that's good.
Marchena, perfectly. And she is a licensed mental health counselor in the state of Florida, and she has agreed to talk to us today about traditional talk therapy. Thank you so much for being on our show.
Thank you for having me. I'm so happy to be here today.
All right. So can you talk to our viewers a little bit more about what cognitive behavioral therapy is?
Yes, so cognitive therapy was developed by Aaron Beck from the Beck Institute in Philadelphia. He's actually in his 90s now and still practicing. He's amazing. And it's one of the few forms of psychotherapy that has been proven to be effective through research to be effective forms of treatment for many different disorders, such as depression, anxiety, OCD, and really helps clients identify what their distressing thoughts are, what causes them to feel anxious, sad, mad, and then I help them learn how to evaluate that thinking using different cognitive therapy tools, and then they learn how to develop more realistic thoughts, a more realistic way of thinking. And when they do that, when they learn how to think more realistically, they feel better.
So what it sounds like, I think I hear you saying, is that what we think affects how we feel emotionally, which then translates into how we behave.
Exactly.
So the approach of cognitive behavioral therapy is to really go into those thoughts and try to sort of approach those and untangle those and work with maybe the negative thought patterns, the automatic negative self-talk that might be happening, and sort of rewire those, and that can help us feel better emotionally, and then that will achieve changes in our behavior as well.
Exactly. And so they really learn my clients really become their own therapists. That's what I tell them. They don't believe me always when I'm working with them, but they really learn how to identify their negative thoughts and talk back to those thoughts so that they can automatically feel better in a short amount of time. And it's very problem solving focused and consistent problem solving and initiating behavior changes as well.
Excellent. Now, so if somebody comes in for a session for CBT, cognitive behavioral therapy, what would a session typically look like?
Okay, so my clients come in with a notebook to therapy. All cognitive therapy sessions begin with a notebook, and we begin the session by reviewing what their homework was, what they did the past week, and if they completed the homework, I also ask them how their mood was on average for the week. I ask them their sadness and anxiety levels for the week on average from 0 to 10, and they give me a number. And then we review the homework, we review what they did and how they did with it. And then I ask them what they want to focus on for that session. So they have like 2 or 3 topics that we can focus on for that session. And then we pick what they want to start with. And then we use the cognitive therapy tools like the questioning. I ask them what evidence is there for your thought, what evidence is against your thought, what's the worst possible scenario, what's the best possible outcome, what's more realistic. So different questions that I help them gather evidence so they can develop a coping statement for their distressing thought. And then they write their coping statements in their notebooks, and they use that during the week to help them if the distressing thought happens again, they have their coping statement with them and they review them.
Excellent. So how is this, and I think you sort of already answered this a little bit, but how is this type of therapy perhaps more useful than other types of therapy that might be marketed to the public?
Yes, so I think it's more useful because cognitive therapy is really brief form of therapy. It's solution focused. It's focused on really problem solving. Clients really learn how to evaluate their thoughts in an objective way. And like I said before, they really become their own therapist. They talk back to their thoughts and they improve their moods. They also make behavioral changes. And a lot of times they can do this without medication. They don't need to go on medication for depression, anxiety, and they feel better because they can improve their symptoms without having to go on medication.
Excellent. And of course, that's what a lot of clients like to hear, is that they don't have to go on medication.
Yes.
So if
Yes.
they are on medication under the care of a psychiatrist or a
Yes.
licensed medical practitioner, we can also help them understand maybe some of the symptoms that might be affecting their mood or emotions as they go through the process, right?
Yes, I always say that if they're already on medication, that's okay. We can still, it's still possible. Yeah, medication doesn't solve all the problems. They still have to do the work. And then, but if they aren't on medication yet, I tell my clients to try it for 4 to 6 weeks. And if they feel better, then maybe they don't need to go on medication. But if they don't get better after 4 to 6 weeks, I always refer them to a psychiatrist or their doctor.
Excellent, excellent. Now, how can somebody find a cognitive behavioral therapist in their area if they'd like to work with one?
So if they want to work with a cognitive therapist, they can go to the Academy of Cognitive Therapy.org, and they have a list of cognitive therapists nationwide and worldwide that they can work with in using CBT or cognitive therapy.
Excellent. And as well, there's some other online resources like Psychology Today. They could do
Yes.
a search, and really what they're looking for is some derivative of the acronym CBT or
Yes.
cognitive therapy. Any of those would help them know that this is the approach that they are getting.
Yes, and that also the BeckInstitute.org has a list of cognitive therapists as well that were trained at the Beck Center. That's where I was trained.
Excellent. Now, if somebody is in the great state of Florida and they'd like to work with you, how can they find you?
They can find me on my website, which is www.jessicamarchena.com. And my website, they can find more about me. And my cell phone is 561-542-2466.
Excellent. JessicaMarchena.com. We're going to put the information in the drop-down description for this video, as well as it should appear at the bottom of this video as we're talking about it. Thank you again, Jessica, for being with us today and being part of our show.
Thank you, Anabelle, for having me. It was great.
You're
great
welcome.
to be here.
And thank you so much to our viewers for tuning in and watching. Make sure that you hit subscribe and that you stay tuned, because more videos are on the way.